This is Focus with Jack Caudill.
Good evening, I'm Jack Caudill. Welcome to this month's edition of Focus. This month we're talking about National Brain Injury Awareness Month. Three guests with us to talk about that. Justine Ashokar, she is the Director of Clinical Services for the Brain Injury Rehabilitation Center in Black Hills Works. Dr. Matthew Simmons, he is a neurologist with regional health with over 28 years of experience. And Branden Stackenwalt, he was a soldier with the U.S. Army when he suffered a traumatic brain injury when an IED blew up his vehicle in Kandahar province in Afghanistan back in 2009. Again, I mentioned March is National Brain Injury Awareness Month. Today, Brain Trauma Foundation says about 2.5 million people each year suffer a traumatic brain injury. The Centers for Disease Control and Prevention says falls are the leading cause of those brain injuries, followed by motor vehicle crashes and being hit or colliding with an object. And Justine, we'll start with you. When we talk about the term brain injury, what does that mean? What kind of forms are there of brain injury?
There are different kinds of brain injuries. You have the traumatic brain injury and the acquired brain injuries. Traumatic brain injuries are caused by penetrating wound, like a gunshot wound, or it could be by falls, it could be by a jolt to the head, and sometimes you have milder brain injuries called concussion as well. And that can be because of a jolt to the head, and the head is not injured. Sometimes the brain is jostled back and forth, and then there's injury to the brain. And then you have acquired brain injuries where you have like stroke and anoxia, hypoxia, lack of oxygen to the brain that can come as a result of heart attack or other organic syndromes as well.
And Dr. Simmons, when you think of the term brain injury, what comes to mind for you?
Well, we certainly heard a comprehensive explanation there. Brain injury is often specifically referring to traumatic brain injury as being one of the more common scenarios that we see. And so that means that there's some sort of external force that is applied to the head that causes an internal injury to the brain.
Branden Stackenwalt, again, we talked a little bit about your situation back in 2009. Can you tell me what happened with you at that point?
We're doing what was called a routine clearance patrol down in the southern part of Afghanistan, and it removed our homemade explosive, and it ended up destroying our vehicle and killing a buddy of mine and wounding 2 others and myself.
Now, you're talking about the brain injury. What sort of brain injury did you suffer at that point?
At that time, I guess what you could say is I forget things a lot, I get headaches sometimes, you get emotional swings and stuff like that. Some people have also been known to have seizures and stuff like that. It just, it just depends on how it affects a single person.
How severe was the injury that you suffered over there?
I wouldn't really know off the, well, my doctors tell me I'm kind of moderate in the moderate stage. Not really 100% severe, but in the middle, I'd say.
Now, Dr. Simmons, he's talked about some of the effects that has had on him. What are the effects that brain injuries will have on people who get them?
There's a large spectrum, kind of as he pointed out, each person is individualized based on what type of injury it was. And as you heard, there are all different types of injuries. Sometimes the skull is fractured, sometimes it's not. Sometimes a person loses consciousness, sometimes they don't. Sometimes they have injury that we can see by taking pictures of the brain, and sometimes we don't see the injury, but we know that they're not functioning normally. So there's a very large spectrum of injuries that can occur. And as he pointed out, we often describe them as being mild, moderate, severe, depending on what type of an injury it is and how it affects the person. And the treatment's going to follow based on an individualized treatment plan based on the needs for that particular patient. As you heard, there are a variety of symptoms that any person might experience, and any of those things might need to be addressed.
Justine, the patients that you deal with at the rehabilitation center, what kind of range of effects do those people have? What kind of symptoms are they having over time?
They have symptoms from cognitive to emotional to sensation, different kinds of symptoms. What we do in the beginning is a neuropsychological evaluation to see where the patient is with his cognitive abilities, and some of the symptoms that we see are problems with memory, attention, concentration, and sometimes we see emotional problems as well, depression, anxiety, and those things can come as a result of the brain injury, and sometimes it's due to the situational losses as well. And so we see these things, we do an evaluation at the outset to see where the strengths are and where the weaknesses are, and then we build from there.
What kind of treatments are available for brain injuries?
We have a cognitive rehab program. It's a comprehensive. We have speech language pathology therapists, and we have an occupational therapist and a counselor, and we also have assistance with employment exploration. So as they progress through the program, the final goal can be either they are looking for a job or some meaningful volunteer work. So they go through the initial evaluation, and then there's an individualized plan to help the person adjust to the current changes due to the brain injury and how to come to terms with that and with acceptance, and then moving on to find new goals and working with those.
Now, Dr. Simmons is a neurologist at Regional Health. What kind of treatments do you guys have available for people that need them?
Sure, and that gets back to the spectrum of injury, right? So if it's anywhere from mild, moderate, severe. So on the one end of the spectrum, something like a mild injury, a concussion, commonly known as a concussion, is a common injury. There's based on the numbers that occur in this country, you would expect in our referral area there would be thousands of people that have sustained concussions within our referral area to our healthcare facilities. So many of those patients are treated at the front lines by primary care providers and sports medicine providers, because sports-related concussion is a common scenario. If it's more severe than that, they may end up in the emergency department because of maybe a more prolonged period of loss of consciousness or some more intense symptoms. And at that point, they're going to undergo a more intense evaluation. And then if there is a more moderate or severe type of injury, they might need to be admitted to the hospital. There is a small number of patients who basically have life-threatening brain injuries, head injuries that potentially would require intervention from one of our neurosurgical colleagues, for example. So the treatment is going to be everything from relatively minor interventions. So on the very mildest side of things, you'd say, well, okay, let's make sure we at least don't have another injury, right? So that's really important, like with sports concussions, right? So there are protocols that are followed in sports medicine such that the first thing is to prevent another brain injury while they're still recovering from the first one, because many concussions are going to take at least several weeks to recover. If it's a more severe injury, but not necessarily needing surgery, then there would be medical treatments that would include some of the rehabilitation strategies. But then whatever the symptoms a patient has, if they're having headaches or dizziness or can't sleep well or their mood is disturbed or something, any of those symptoms could be targeted for specific treatment. On the more severe side of things, if they have bleeding and swelling inside the brain that is creating a life-threatening situation, then that's where the neurosurgical colleagues will step in and do what you would think of as something fairly drastic, and that is to remove bleeding or remove swelling or reduce pressure in order to save the person's life. And then the whole spectrum of rehabilitation would follow from that, depending on what the needs are.
Branden, what kind of treatment, when you were injured in 2009, what kind of treatment series did you go through?
I went through speech pathology and cognitive stuff, as well as memory training and stuff like that, and emotional stuff, training and controlling emotions and stuff like that.
Now, you said you were treated at Walter Reed, you were treated in Germany, you went to a lot of different places that the military took you to, correct?
Yes. I also spent time in Fort Leonard Wood, Missouri, as well as Minneapolis, VA.
Okay. And when did you see, did it take a while for you to start seeing results? Do you see the results of what that went through over that period of time?
Yeah, I think I do. And I had to learn how to walk again, learn how to, swallow regular foods and stuff like that, and, lots of other things as well.
All right, we got to take a break. We'll continue our look at brain injuries and Brain Injury Awareness Month when we come back with this month's edition of Focus. And good evening, I'm Jack Caudill. Welcome back to this month's edition of Focus, talking about brain injuries and Brain Injury Awareness Month. Dr. Matthew Simmons is a neurologist with Regional Health. We were talking about treatments before we took on the break. How are treatments changing and how are those evolving over time?
Okay. So that's a great question. Historically, I think people felt there really wasn't much you could do. There weren't any special interventions. But What we've learned, and a lot of people don't realize, is the brain does gradually remodel itself over time, and there are various factors that play into that as part of the healing process. I think you heard Branden talk about how it's taken a gradual process for him to get back to where he is, and that's typical for brain injuries, that they recover over time. But the first thing is we want to reassure people that the brain does recover over time in many cases, or most cases, and so we just try and facilitate that natural healing process, and we try and take away anything that would interfere with that natural brain remodeling or healing process. So if there are other medical problems going on, if there are symptoms or even personal situations that are interfering with that person's recovery, then we want to intervene in a holistic way to deal with whatever the needs might be. So it might be a combination of medicines and therapies, and also making sure that we don't add any extra problems in that person's life. So if there's a depression or a stress or some other medical condition that needs to be watched, all of those things play into sort of your best brain health, if you look at it that way.
And Justine Ashokar is the Director of Clinical Services for the Brain Injury Rehabilitation Center. In terms of rehab, is that evolving and changing over time as well?
Yes, we do a more of a comprehensive rehab, so we involve the family as well. So it's not just the patient anymore. So we look at the family unit as a whole and help them also with psychoeducation and counseling services, because very often some of the emotional changes can be mistaken. For example, apathy after a brain injury is often mistaken as laziness, and people don't understand that injury to the frontal lobe or cingulate gyrus can cause these problems. But with education then, and with some checklists at home and checking with the counselor, so we all are on the same page, I think that has helped help the person come to terms with what's going on with them and to heal in a quicker fashion.
Yeah, Branden Stackenwalt was a soldier with the U.S. Army back in 2009 when he suffered a brain injury in Afghanistan. Branden, when people talk about brain injuries, are there things that they don't understand, or are there misconceptions that people get when you tell them that you have a brain injury that they need to know or that they don't understand?
Well, I think the consensus for most of the populace would be I guess a lot of people would be able to do research on it, but firsthand it's more of like a difference for me to understand the outside world as opposed to the outside world trying to understand you.
Are there things that you wish they would understand about brain injuries that maybe the population as a whole does not?
A lot of people, it seems like patience, understanding. I know I talk to a lot of veterans, and they don't, if they've been through traumatic things, they tend to only talk to other veterans who have been experienced in that field, and rather than talk to a psychologist or psychiatrist, they'd rather talk to somebody who's been there and has similar experiences.
Are there, Dr. Simmons, are there myths or the misconceptions out there about brain injuries that people don't get?
Sure. So I think one of the things, again, would be to emphasize that there is a lot we can do for people. And I think, unfortunately, a lot of people with minor traumatic brain injury don't seek help. They just think, well, I'll just tough it out, I'll write it out, and just sort of stay home, or don't really seek medical attention. So I think the first thing is to remind everyone that there is a lot that can be done depending on what type of injury they have. And another thing I think is to speak to what Branden was talking about how people they look at you and they think, well, you look okay, I don't think, did you really have a brain injury? Like they kind of doubt, or they might have some questions about, because you're walking and talking and they think you're okay. But the point is that there can be a whole variety of symptoms, as we've heard, that may be ongoing for that person. They may be struggling with a variety of things, even though they kind of look okay on the surface, So I think that's another misconception that people have. And then I guess a third thing I would throw out there is that there may be some strategies that anyone can do to prevent a brain injury, right? So I know you talked about how there's so many falls, especially among our elderly population. So that's a red flag right away telling you, okay, that person's at risk if they're falling, right? So family members and healthcare providers are very sensitive. We should be very sensitive to that scenario, for example, to make sure that our elderly folks, or anyone for that matter who might be at risk for falling, doesn't fall, because that's a common source of injury. And then whatever precautions we can take with sporting activities and military involvement, anything where there's a risk of head injury, that we take the best precautions that we can. So I think that's another misconception, is people don't always think about, well, what can I do to prevent a head injury?
Justine, as you look at it, what misconceptions do you see? What ideas do people automatically get when they think of a brain injury that maybe they shouldn't have?
Sure. Mostly it comes with milder brain injuries because they look like you and I on the outside, and people have a difficult time understanding that this person has an injury. And so that's something that we work on, and support groups are helpful, and counseling groups are helpful for others to understand as well. And the psychoeducation piece of what happens when this happens to a person, mostly it's like a hidden injury. If you have a physical impairment and people can see it, it's a lot easier for others to understand this person is having a broken arm and they may need some time to heal. Whereas with the brain injury, a lot of things are not visible, and especially since it's a hidden injury, and then people have difficulty. And also the myth of recovery. People believe that within the first 2 years they have recovered, and recovery is ongoing. And the brain challenges and is challenged by different experiences in life, and can recover for the rest of their life. So that's another myth that we see in the field of brain injury.
Now, Branden, there are a lot of brain injuries diagnosed in wartime in the military. How much do you share those experiences with other soldiers that are in that same situation? How much do they share with you? And how important is that for you guys to be able to get together and talk this kind of stuff out?
I think it's very important that everybody knows that, you can talk to others, in similar experiences. A lot of people tend to have a more open point of view, and they tend to open up more, kind of come out of their shell. And it's easier for them to do that, considering somebody has mutual experiences.
Is there a bond between the soldiers, like when you were at Walter Reed, all the soldiers that are recovering from a lot of the same things that you're recovering from? Is there a bond that helps that process there?
Oh, of course, most definitely. And, a lot of, like I said, it's just because they have a similar thing, and almost like it's like a commonality. So of course there is. Thanks.
Dr. Simmons, you're talking about sports injuries, and there's been so much talk lately about the NFL and concussions. And how much has that brought this whole world of brain injuries to the forefront, where people are thinking about it now that may never have thought about it before?
Right. Well, it certainly has been in the news consistently. I think it's really increased the awareness. And the good thing is that like in our community, I think there has been a very good effort to prevent and to treat sports-related concussions, sports-related brain injury. And there are guidelines now that practitioners can follow that says, this is more or less a step-by-step approach, how you can treat this person, how you can help them prevent another injury, that sort of thing. So I think that everyone in the community, in the medical community, is in a pretty coordinated effort to heighten awareness, take precautions, to treat people effectively, and to prevent complications.
Justine, do you see much involved with sports in the work that you're doing?
A few, not many, but we do brain injury awareness every March, and every year we increase education and knowledge. So we have a poster competition for school children to draw about the brain and how they can prevent brain injuries. So education is key, I think, in preventing these injuries. And like Dr. Simmons said, follow up and education with the school teachers as well as the parents, knowing what signs to look for when a person is injured in the football field, what to look for and how to go about that, I think, is also very important.
All right, we got to take another break. We'll continue our look at brain injuries when we come back with this month's edition of Focus. March is Brain Injury Awareness Month. Justine Ashokar is the Director of Clinical Services at the Brain Injury Rehabilitation Center and Black Hills Works, talking about prevention. What kind of prevention things are there? Are there just something as simple as a helmet? I mean,
yes.
How big of a deal is that for...
It is a big deal, especially for young children who are in sports-related activities. It does preserve and help to a great extent, and also being aware of the surroundings and the situations that they are in, education. If they do fall, even with the helmet, what to look for, those are definitely big things that they can learn ahead and understand when coming to saving their brain.
Dr. Simmons, as you treat people that have had these injuries, how important do you see the importance of helmets on a pretty much daily basis?
Sure. Now the helmets, it should be emphasized that the helmet is primarily there to prevent like skull fractures and that type of injury. How much it actually prevents the brain from being jostled very violently with a high impact is not as good for that, right? Because the brain is a very soft organ, and it can be jolted, even just like if you think of it like a whiplash injury or just being pushed violently, or a blast injury, for example, we've heard about. So any kind of force that shakes that brain internally, a helmet isn't necessarily going to protect everything. In fact, you were probably wearing a helmet when you had your injury, is that?
Yes.
Okay. Okay. So just to point out that that the helmet is not going to protect you from everything. It does help, of course, and it especially helps prevent like skull fractures and that type of an injury.
Now, people and kids particularly are hitting their heads all the time. How, as a parent or anybody, how do you know he hit his head to the point where, okay, I need to go see somebody about this? Where is that defining line?
Well, first of all, if in doubt, go get checked, right? Mm-hmm. Because sometimes what looks like a minor injury might actually be much more severe. So if in doubt, always go get help. But the things that would tip people off is if the person's acting differently, if they're developing bad headaches, throwing up, if they're really looking sick from this injury, or if they've had a loss of consciousness. Those are the types of things that, or amnesia, like if they can't remember what happened and they're not remembering things after the injury. Those would be all good examples of where you'd want to go get checked out.
Now, Branden, you've come through this again back in 2009, hit with an IED in Afghanistan. How much more aware are you of the brain and brain injuries that you weren't before? I mean, is this something you ever thought about before that day?
Before, no. We did always do a little bit for cautions and stuff like that, for training and stuff as well. So we did know a little bit about it, but not as much as we do now. Education is certainly going to help.
Now, talking about education, where can people get more information? Where do they go to learn about this kind of stuff?
Well, nowadays, everyone's on the internet, of course, and there is a lot of good information there. Sometimes we have to help patients sort out what are the best, sites to go to. But there's educational information from anyone that deals with certainly any sports-related, sports concussion type of thing. They're all well educated, like athletic trainers, coaches, sports medicine physician. Anybody like that is going to be at the front lines of those folks who are at risk for concussion, for example. Other than that, I would say there might be a brain injury support group, I think I heard you say, yes. And of course your organization would do educational programming. I don't know, maybe you want to talk about what educational programs you have.
Yep, we've got about a minute to go.
Yes,
so.
We do presentations at different settings. If they invite us to talk to school teachers, we can discuss concussion and how to work with those. And we also have support groups every second Tuesday of the month at 6 o'clock at the Brain Injury Rehab Center. Everybody is welcome to come. And we also go to the Centers for Disease Control websites. They have really good presentations on concussions for the teachers, for the parents, and for the educators. So that's another place to look for information.
How do they get a hold of you guys if they want to? Oh, there it went. How do they get a hold of you guys if they need to?
They could call our number, the Brain Injury Rehab Center.
All right. Well, sounds good that we are all out of time. Justine Ashokar, Dr. Matthew Simmons, and Branden Stackenwalt, thank you guys all for coming up and kind of spreading some awareness here as we hit Brain Injury Awareness Month in March. And that will do it for us for this month's edition of Focus. Hope to see you again right here the first Sunday night of next month. Good night.